Hi, I'm Dr. Jamie Mitchell. I'm the senior surgeon and the medical director at the Norman Parathyroid Center and medical director of the Parathyroid Surgery Division at the Hospital for Endocrine Surgery in Tampa, Florida. I'm going to talk today about reoperative parathyroid surgery cases. I do quite a bit of reoperative parathyroid surgery at this stage in my career. It's become one of my areas of interest. And throughout the country, many patients undergo parathyroid operations which unfortunately for one reason or another are not successful and they're not cured of their disease. And while surgeons are all doing the best that they can, and some of these outcomes are inevitable, what's frustrating for me is that a lot of times these patients are simply left without any plan going forward in terms of trying to get their disease cured, and they don't know what to do. So I decided to run through some of these reoperative cases that I've done over the years in the hopes that people may see these and realize as patients or maybe even doctors possibly that there are options for patients who undergo unsuccessful parathyroid operations in the future. So the first case that I'd like to review is a really lovely 77-year-old woman from the Boston area. She has an incredibly complicated parathyroid surgical history, which began actually in 1995 when she was diagnosed with primary hyperparathyroidism. She underwent her first operation at that time where a right thyroid lobectomy was performed and no parathyroid tumor unfortunately could be identified. It's not unusual when surgeons cannot identify a tumor to remove the thyroid lobe, hoping that it might be hidden inside the thyroid, but in this case that was not successful. A normal lower parathyroid gland was removed incidentally during that operation, but no tumor, and she unfortunately was not cured. A number of years later, in 2008, she underwent another operation, this time at a very well-known academic surgical hospital in Boston. And during this operation, a very extensive right-sided operation was performed. Now, both of these operations were right-sided because she had imaging tests that suggested that her problem was a tumor on the right side of the neck. So she underwent another very extensive, lengthy operation where no parathyroid glands, unfortunately, were identified. She continued to suffer from the complications and symptoms of her disease, and 3 years later underwent a third operation at another academic hospital in Boston this time, where another very extensive right-sided operation was performed. Unfortunately, during this operation, no parathyroid glands were identified again, and she had some unfortunate complications where her carotid artery was injured twice that required sort of emergent vascular surgery intervention to repair, and the nerve that controls her vocal cord on the right side was permanently paralyzed. So she continued after all this surgery to have persistent disease, and nothing really was done for her after this operation for several more years. In 2016, as she's had more imaging tests that continue to suggest the same thing, that she had a tumor on the right side of her neck, she underwent a procedure called cryoablation, which, to be honest, I've never heard of being done for parathyroid disease, frankly. So this was performed in an area where they thought her tumor was. They tried to freeze it to death, essentially, and not surprising to me, this wasn't successful either. I think at this point they did not think there were any surgical options for this woman and were just trying anything that they could. But again, unfortunately, this was unsuccessful. So now she's had 3 very extensive operations, an unusual cryoablation procedure, all on the right side of her neck, and none of them have been successful. And at this point, I think her doctors told her there was nothing else that could be done for her. A number of years went by, and then she began to winter in Florida from the Boston area, and as a result of that, she learned of our center. And I met with her. We discussed her very complicated case and talked about the options. And with a case like this, with all the surgery that she'd had, a blind reoperation, meaning going back into her neck without an obvious target, would not be a great idea. So we brought her to the Center for Imaging Tests and performed both a sestamibi scan, which is a traditional imaging test for parathyroid disease, as well as a 4D CT scan. And when I reviewed her 4D CT scan with her, there was an obvious finding that was consistent with a right upper parathyroid adenoma. And interestingly, when you have failed operations like this, the thought is often that the tumor or the parathyroid is in an unusual location. That was not the case here. This was in a very typical spot for a right upper parathyroid gland. So here I'm showing you what's called a sagittal view of the 4D CT that this patient had at our center. And I'll just point a couple things out. You can see the orientation here. What you're seeing here, this dark area is the trachea. It's dark because it's full of air. Obviously the spine is here, and we're going to be moving from the patient's left to their right side now as we scroll, and you're going to see a couple of things. These are surgical clips from her previous surgeries, and shortly you're going to see right next to these clips is this enhancing mass. This is her parathyroid tumor. And it's incredible to see how close these surgeons were to this tumor, right next to it essentially without being able to find it. But this is her tumor, and this is a typical spot for an embryologic upper gland. This is not an ectopic location, which in my experience is usually the case with failed parathyroid operations, even at well-known academic centers. Okay, here's another imaging study that this patient had with us. This is probably the most common imaging study done for hyperparathyroidism, called a technetium sestamibi scan. It's a nuclear medicine X-ray that uses a radiopharmaceutical chemical that we hope parathyroid or abnormal parathyroid tissue will take up and show us where it is. As you can see, there's not a lot of anatomy on these scans, really just shades of gray that we're interpreting. But what you can see here is you get a vague outline of this patient's body. Here's the neck area, and this little signal here is the left lobe of the thyroid. Now this patient, as I told you, had a right thyroid lobectomy, so she has no thyroid lobe on the right side of her neck, and yet she has this big, even darker signal over here. And this is her parathyroid tumor. If you look down here on these images, it's maybe hard for you to tell, but in this image, this patient is looking off to the left, and here she's looking to the right. And the way that this signal moves this way and then this way indicates that this is an embryologic upper parathyroid tumor. So based on these findings, we took her back to the operating room for the fourth time, and I was fortunate enough to be able to find this tumor. It was difficult as it was encased in quite a bit of scar tissue from all the surgery that she'd had, but we were able to find this tumor and remove it successfully. Her parathyroid hormone that we checked before the operation was 130, and after surgery in the recovery room we checked it again and it was down to 17, low for the first time in 30 years for this woman. Needless to say, we both were pretty happy with the result, and one of her biggest symptoms was crippling bone and joint pain from this disease, and that went away almost instantly for the first time in many years. So this is an example of an excellent outcome, and I'd like to use it as an example of even after very complicated failed operations like with this woman. This is an extreme case, but there are still options for these patients, and I would hope that if you are a patient who's gone through something like this, or even a doctor who has a patient like this, you would consider referring those patients down to our center for evaluation, because most of the time we can be successful.